My name is Jessica, and I'm the mother of 3 girls. 2 I gave birth to, the third I adopted. I am never going to give birth to another child again. And it's not because I can't, but it's because I choose not to. My level of trust in another human being isn't there anymore. You can do everything right and still have things go wrong. There are things that you cannot plan for, or no matter how prepared you are, you don't get what you expect. All of my children were planned and prepared for. None of them were accidents. When I decided I wanted to have kids, I started taking prenatal vitamins, and I saw my doctor, and as soon as I got pregnant, I started to make sure I got enough rest at night and I ate well, and attended all my prenatal care visits. I read all of the books about pregnancy and labor and delivery, and then also child care, and I really did a lot of preparation for having my children. My first delivery with my first daughter was very long, but it was a good experience. I had a beautiful, perfect baby girl at the end of it, which made 9 months of sacrifices worth it. And when I say sacrifices, I really mean just drinking less than 3 cups of coffee a day. I really didn't have a whole lot that I had to give up while I was pregnant. I had pretty good healthy habits all along. My second labor and delivery started out very much the same way as my first. My water broke at home, and then I went to the hospital with contractions. Second time it went much quicker, which I heard was normal for a second baby. I spent the majority of my time in the shower because the pain was very severe, and I did have both of my children naturally. When it came time to push, I was instructed to move on to the bed by the midwife. So I moved to the bed and I began the process of pushing. After pushing for a while, I didn't feel like I was making any progress, and the baby was not really coming out. So the midwife called in a few nurses for backup, and I really worked hard and bared down to push. Eventually, my daughter's head came out, and nothing else. It was just her head. It is the strangest feeling in the world, having a human half inside you and half outside of you, and she was completely stuck. I panicked a little bit, and everybody in the room kind of panicked a little bit. I pushed, and the midwife grabbed onto her head and pulled. Eventually, after about 2.5 minutes, she came all the way out. I didn't get a hold of her right away. They rushed her over to a bassinet warmer, and they did some work on her, while I just looked from across the room, just waiting to hear her first cry. And it was music to my ears when she finally cried. A bit later, the nurse brought her to me, and she was all swaddled up, and she had told me that her arm was had been pinched or stretched, and so it was pinned against her chest, and she was swaddled in a blanket, and it was holding it there steady. I just marveled at my daughter Jenna and how beautiful she was, and how glad I was that she was finally here and that the pain was finally over, or so I thought. In the hospital that night, Jenna cried and cried. There was nothing I could do to get her to stop crying. Eventually, I was so tired, I called in a nurse and just handed her over and said, "She won't stop crying." And so the nurse took her, and I was able to get some rest. I woke up a few hours later, and they brought her back to me, and she seemed to be doing okay. We were released to go home the next day, and the pediatrician checked out Jenna and said that she had a pinched nerve from delivery and that she should be fine in a few days. So I took my daughter home, and when we got home, she cried all the time. There was nothing that I could do to keep her comfortable, and I felt like my baby hated me. I immediately began to have postpartum depression because I was very disappointed in myself and in the inability to comfort my daughter and be a mother to her. I was on the community program WIC, Women, Infants, and Children, and just a few days after I returned home, a community health nurse came and had a visit with me. And she took one look at Jenna and said, "She has Erb's palsy." And I was pretty tired and pretty stressed out. I didn't know exactly what that meant. But then she explained to me that as Jenna was being pulled out while being delivered, the nerves in her neck and shoulder were damaged. I learned later that there's different levels of this damage, and I learned what Jenna's damage was. I went through a period of grief, just like any other period of grief that they talk about, where there was anger and denial and acceptance. The acceptance came a lot later. I was lucky enough to get Jenna right in to the brachial plexus clinic at Seattle Children's Hospital, where she had appointments with different physical therapists, occupational therapists, neurologists every 3 months. It became a regular thing that we were going over there at least every 3 months. We were also in the school district infant toddler program, and we had therapists, occupational and physical therapists that came to the house and brought everything I needed, and that probably saved my sanity, because not only did I have this newborn, I also had this 3-year-old that I was trying to take care of at the same time. And they came and they showed me how to do the physical therapy and the passive range of motion, and everything that we did with Jenna at that point, every form of play had turned into some sort of therapy. My nights were sleepless for the first 2 years, because even if Jenna slept through the night, I still would wake up every 3 to 5 hours to do her passive range of motion, which basically consisted of stretching her arm out and moving in all the different directions necessary while she was asleep, because she fought me when she was awake, and she would cry, and I just couldn't hear her cry in pain anymore. So I would wake up at night a couple times a night, and I would stretch her arm while she was asleep. Jenna became very wary of strangers. Every person that she met wanted to reef on her arm in some uncomfortable way and cause her pain. And so whenever she got too close, or whenever someone approached her, she immediately was angry. And I don't blame her. She was put in a lot of different uncomfortable positions, and she had to wear and be fitted for a lot of different orthotics and things to keep her arm in positions and to straighten it out. And she had splints made and casts and braces and a lot of things that she didn't like. There was only one doctor that she actually really hit it off with, and that was Dr. Glass, her pediatric neurologist. He was charmed by Jenna, and Jenna was charmed with him, which was very unique, because she usually was very particular. She eventually was scheduled for a tendon transfer surgery at Seattle, which means that her nerves did not regenerate and grow back where they needed to go. So the doctors had to cut a muscle and attach it to nerves that actually worked. So we went to Seattle, and it was an overnight stay, and she had the surgery. And I remember her coming out of that surgery, and she was in a steel brace that kept her arm up like this. It was around her body, and it held her hand up about like this. And she had to be like that for 6 weeks. And when she woke up from anesthetic, she was angry, and she was in pain, and she didn't understand. She was confused. She was only 2, not even 3 yet. And she was starting to potty train at that time, and I remember her saying she had to go potty, but getting her into the bathroom was tough, and it ended up her screaming, and me trying to hold her in this hopefully comfortable position for her while she's in this brace, going into the bathroom. She peed all over me, all over the floor, and then I fell down in it and just cried. We were both just sitting in the bathroom in a pile of pee crying when the nurse came in to help us. And I thought that I had ultimately failed as a mother, because I had done everything right and tried to keep her safe and make sure that she was perfect. And she was still dealing with this and in pain. So we ended up staying the night, and I remember waking up between 4 or 5 a.m. in the morning, because not only Jenna was crying, but children throughout the whole floor were crying in their rooms with breakthrough pain from the pain medication that had worn off during the night. And so they woke up and they were crying and in pain. So I took Jenna home from the hospital, and she had this brace. And she was, I don't know how many of you believe in astrological signs, but she's a Leo. And she can be very, very charming and have a lot of charisma, but she will not do anything that she doesn't want to do. And she's always been very clever. And she was in preschool at that time, and she had this brace. And all the kids in school were told to be careful of Jenna's arm, be careful of Jenna's arm. So if she had something or saw something on the table that she wanted, she would grab it and she would put it up in her other hand. And so none of the kids could take it from her. So she quickly learned how to use her disability, I guess, as an advantage. She's been this way her whole life. If she wants to do something, she's going to do it. She did cheerleading with her bigger sisters in the Future Riders cheer, and she was very good at it, and she really enjoyed it. I remember hearing loud stomping in her room, and I went and I peeked in, and she had the jump rope. She was probably in first grade at this point. She had the jump rope, and she had hardwood floors in her room, and she was trying to jump rope, and I was watching her, and she was jumping and jumping, and she couldn't quite get the right rotation with her left arm. So she would jump, and then she'd stop, and she'd go, "Ah!" and she'd slam the jump rope down on the floor in anger, and then she'd take a breath, and she'd try again, and try again. And she did not stop. She was in there for hours. She did not stop until she knew how to jump rope. We went to Great Wolf Lodge, and her favorite thing there was the lily pads with the monkey bars over the top. And she spent all day trying to cross that, falling into the water and going back again. And eventually, she did not stop until she was able to get from one side to the other across the monkey bars, one arm to another arm. So she does everything that she wants to do. Now, what I learned from all of this is that I can't plan for what's going to happen. And it doesn't matter what I do. There are so many circumstances that can change in my life. What I do is I have to do the best with what I've been given. And I have a choice every day to encourage people around me or to let it take over me. And Jenna, not just, she's got a good personality, but I'm glad that I've been able to step up and give her the opportunities that she needs. But I'm also very grateful that she has shown me how to do it, because I certainly couldn't have done this without her.